360 view. I have my mark, and the question is here: knock knock, hand hygiene, privacy, safety check, brakes check, environmental scan. Hi, Miss Fiona Sherrick. This is Shubham Chaudhary, practical nursing student from the Sharing College. I'm here to do your. I will say Shubham Chaudhary, practical nursing student from the Sharing College. May I know your name and date of birth? Fiona Sherrick. Fiona Sherrick. Date of birth February 25, 1980. February 25, 1980. I have confirmed with the patient's verbal expression as well. Ms. Fiona Sherrick, I'm here to do your trachea. I'm gonna explain the procedure to you. This procedure is will take 15 to 20 minutes, and it's a sterile procedure. So if you feel discomfort, make sure you don't bring your hand in a sterile field. You let me know. I'll just stop and we'll do further procedure after that. I'm gonna place my patient on a semi-fibular position and put my patient on a hyperextension so my patient can breathe and do all the procedure. Then I'm gonna put the towel on. I'm gonna wear normal gloves. And I'm gonna remove the gauze, and I have checked the secretion. It's a 50% secretion, and I will make sure that I make sure that what was the secretion, so I can document afterwards. Now I'm gonna throw this into the garbage. Now I'm gonna put on oxygen on for my patient, and I'm gonna make sure that what is the baseline for my patient. Before we begin, I'm gonna auscultate. I see a normal clear lung. There is no ventilation sounds, and O2 saturation is 96 for the patient, and it should be in between 92 and 96. Now I'm gonna wear non-sterile gloves. Then I'm gonna throw this into make sure. Now I don't need this anymore, so I'm gonna throw this. I've checked normal saline. Normal saline is not expired. I've checked expiry date. Now I'm gonna pour it here, and I'm gonna pour it here. And make sure that this is in like a according to the trach tubing. Inner cannula. Now I'm gonna check that inner cannula's movement, how it's intact, and what is the size of the cannula and the movement of the cannula. Now I'm gonna remove the inner cannula, and I'm gonna throw this into the normal saline, and then I'm gonna give 2 puff, and I'm gonna 2 breaths, and I'm gonna observe for the chest expansion. Now I don't need this anymore, this gloves, so I'm gonna throw this, and I'm gonna perform my hand hygiene. And make sure that I'm not touching anything. If I touch, I'll get any new gloves. Now I'm going to use scooping method to wear the other gloves. And make sure this doesn't come in my sterile field, and I'm gonna perfect. Now I'm gonna clean my cannula, inner cannula, all the way inside with my non-dominant hand. This is my non-dominant hand, and I'll make sure that I touch from the tip, and I'm cleaning it from inside and out. And then I'm cleaning from the outer part. Then I'm gonna use my dominant hand to hold this, and then make sure that I'm not breaking any sterility. Then I'm gonna pour normal saline on top of it, and I'm gonna clean this with my dominant hand. I'm also making sure that my patient's O2 saturation is in between 92 to 96. It's not cutting down. Now I'm gonna use tip of my tip, and I'm hearing click, and I'm going to break any sterility. Now I will start performing care. For the care, first I will start by uh, 12 to 9. Then I'm gonna throw this. And again I'm going 12 to 9. And again I'm gonna throw this. I'm doing 3 to 9. And I'm gonna throw this. I'm doing 3 to 9. And then I'm gonna throw this. I'm gonna dry in the same manner. Twelve to 9. To 9. Three to 9. 3 to 9. Now it's cleaned. I make sure I haven't broken any sterility. Now I'm done with the care, and my patient's O2 saturation is in normal range. Now I'm gonna put on a new gauze. So I'm gonna twist the gauze. With my sterile hand, and I'm gonna place it under here. And now I don't need to be sterile anymore. So I'm gonna use one stick to tuck this in. My new gauze is there. I'm gonna throw this. Now I'm gonna take a new strap, and first I'm gonna tie this. And then I'm gonna remove the old one. then I'm gonna garbage everything in there. Thank you, Miss Fiona Sherrick, for your cooperation. Now I'm gonna go and document my findings, and then I'll get back in half an hour and evaluate you. I've checked that oxygen level is she's maintaining, and it's 96%, and I'll now put it on the mask oxygen again. Now the two questions. Why might you perform tracheostomy care on a Miss Sherrick? Is because it could be 3 reasons. It excessive secretion, solid error, loose of a tie, and soaked gauze. And we'll assess lungs. We do lung assessment, and we also assess the amount of secretion, order of the secretion, and the patient pain level and oxygen maintenance. Thank you so much. And I'm gonna put bed all the way down on a supine position and all the way down, and I'm gonna then I'm gonna remove the supplies for it not need to be here. Thank you so much.